Our necks perform more range of motion than anywhere else on the spine, and this makes our neck extra vulnerable to overexertion and joint degeneration.
Thanks to modern medicine and advances in artificial disc replacement, today's patients have more options when surgery is needed. Now we travel to Minneapolis to learn more. Take a look. Neck pain is something we're all likely to be familiar with, whether it's talking on our phones, working on the computer, or just having a stressful day. In fact, it's estimated that about 50% of us struggle with some type of cervical disc degeneration, and the numbers continue to rise as we age.
Degenerative disc disease of the cervical spine is nothing more than wear and tear. The discs are the cushions between the bones of our neck, and as we age, they lose some of that water, and as the water comes out of it, they degenerate.
For most of us, the aches and pains are occasional, but for many, neck and the associated arm pain can be severe, and for some may lead to disability and the need for surgical intervention.
If you get enough wear and tear to the disc, and sometimes it's even arthritis to the joints of the neck, it can narrow the hole for the nerve. As that nerve is narrowed and compressed more and more and more, it can start to give the symptoms of radiculopathy. And some people it affects greatly. It profoundly affects their pain level, their ability to function in society, to take care of themselves and their family.
For Katie, a busy mother of 3, what she thought were typical aches and pains seemed to be getting worse day after day.
A couple of years ago, I started to notice some pain that was in my neck. Pain where I would feel like, oh, I should go get a massage, or I should, maybe I'm a little bit sore there. It started on my neck, it started to go down my arm. I was feeling the pain then in my hands and feeling like there was a weakness. It was not going away. It was getting more severe day by day.
The conservative treatment is always the best way to start. Conservative therapy for neck pain, for degenerative disc disease, is simple things like activity adjustment, maybe avoiding the thing that was causing the problem. It can be taking anti-inflammatory medications. It can be physical therapy, chiropractic. All of those things can have a very positive effect on people's pain in their neck.
Katie sought the opinion of a chiropractor and soon immersed herself into a routine of physical therapy, massage, and corticosteroid injections, hoping to find some relief.
I had an injection, which my first injection, I did have some relief from my pain. So I thought, this is great. We've solved it. I've done the PT, I got this injection, I'm feeling good. I went on a vacation, and a few weeks later, I started to get that dull pain. I was like, oh, nope, time to go back to the specialist. He prescribed another injection. That injection did not work. When that second injection did not work, I was sad. I was defeated. And then at that point, the physician, the specialist that I was seeing, referred me to a spine specialist.
When patients have tried conservative measures that haven't worked for them, they generally come see me and we talk about other surgical options. Hopefully it's after 6 weeks or so of conservative measures. We then talk about sort of 2 options to open up the nerve from the front part of the neck. The first part would be a traditional ACDF, anterior cervical discectomy infusion. That's been around for 50 years. We go in, we make a small incision in the front part of the neck. We go down, we scrape out the bad disc and the bone spurs that are pressing on the nerve. And when we're all done, we put in a piece of bone and a small plate. It works, it's a very good procedure. Another option besides the fusion is a cervical disc replacement, or cervical disc arthroplasty, or the Mobi-C. The Mobi-C is, for lack of a better term, a disc replacement. People can think of it like a knee replacement. You go in and instead of placing a block of bone and a plate and locking the level together, you put in a device that continues to move like a normal disc. Really the only difference between the two is at the end of the day, the fusion stops the motion and the disc replacement allows continued motion.
One of the things that I was concerned about when I looked at all the options, or even thinking about having surgery, is what am I going to be like afterwards? Am I going to be able to move my neck? In talking with Dr. Wills about what the Mobi-C product does, is that was going to get me to the point where I wanted to be, which was to have full mobility in my neck and alleviate the pain that I was feeling.
After weighing all the risks and benefits, Katie decided to have the cervical disc replacement surgery with the Mobi-C.
The implant was designed to try to mimic normal neck range of motion as much as possible. We've taken the concepts of continued motion and put it in the neck. A good candidate for a disc replacement is an adult who has attempted non-operative measures that hasn't worked and continues to have nerve-type pain or weakness or problems, that radiculopathy, who wants to do some other surgical option than a fusion.
Waking up from the surgery was great. Dr. Wills had explained to me when I get into recovery, when I woke up, I would be in pain. There would be pain in the incision area and then in the back of my neck, because that's where they do the work. But the other pain, the pain that got me there, this whole journey, that pain hopefully would be almost gone or completely gone. And when I woke up, it was gone.
The disc replacement Mobi-C surgery is a procedure that I've noticed in my patients they've recovered quite quickly from. They've done very well. They notice that the pain is not very bad in their neck. It's surgical pain, it's incision pain, but they don't have that nerve pain, that radicular pain anymore. And it makes a world of difference to take away that type of pain.
As I sit here 4 months post-op, the thing that comes to mind is I wish I'd done it sooner.
To find a trained Mobi-C surgeon in your area, visit cervicaldisc.com. And as always, you can go to our website, thebalancingAct.com.